The so-called public option government-run insurance program is out, and the Medicare buy-in, which I thought would jeopardize Medicare, cost taxpayers billions of dollars over the long haul, increase our deficit, is out, and there's no other attempts to bring things like that in, then I'm going to be in a position where I can say, I'm getting toward that position where I can say what I've wanted to say all along, that I'm ready to vote for health care reform. My whole point has been here that the president laid out a couple of big goals for this process. Bend the cost curve down for individuals, families, businesses, our government, our economy of health care. And secondly, bring a lot of people in who can't afford health insurance now. The basic core bill does that. I think some of the other things we're going to add to our debt, increase taxes, and were just not necessary to achieve those two goals. So I think we're heading in the right direction.
You've got a lot of insurance companies in your state. How much pressure, if any, have you been getting?
I thought you said you were going to be reverent.
I'm trying.
I haven't received any pressure from the insurance companies. I mean it. Periodically, they'll talk to my staff about one thing or another, but I'm taking these positions. I've never hesitated to take on the insurance companies.
Can you
hold on? And so I'm just, the reason I was against the public option is the same reason that a lot of people are worried about this overall health care reform proposal, which is that they think it's getting too big, and they worry that it's going to increase their taxes and increase the national debt that their kids and grandkids are going to have to pay. So that's why I was.
Can you explain why you changed your mind on the Medicare buy-in?
Well, I didn't change my mind on the Medicare buy-in. I mean, I know this is a classic sort of sport here. Although it's not terrible to change one's mind if in fact you do, but I don't want to spend too much time on this. In the 2000 campaign, when I was privileged to be Al Gore's running mate, the party platform was to suggest one way to reform health care was to allow 55 to 65-year-olds to buy into Medicare. That's a very stressed age group when you don't have insurance. But a lot of things have changed in the 9 years. First is that 2000, the federal government was in surplus and paying off the debt, not having increased the debt enormously. Secondly, Medicare wasn't on the verge of imminent bankruptcy, which it is now. And third, there wasn't a bill on the floor, such as the one on the floor now, that would extend very generous subsidies to those 55 and 65-year-olds to enable them to buy insurance and reduce the impact of age in the pricing of insurance policies. So things changed a lot.
More recently,
in the Conneticut Post interview, well, I finally got to see that on TV last night, and it looked to me like I was referring back to things I had supported in the past to make the point that though I was against the public option, I was not against health care reform. And of course, I did that before the Finance Committee bill came out with this very large, and again I'd say generous, but I support it, system of subsidies to bring basically lower middle income people into the health insurance system.
But Senator, weren't those subsidies baked into the health care reform architecture long before that?
Not to that extent. But look, here's the point. The Medicare buy-in as proposed didn't make sense. I mean, you can all focus on it, but it ended up, it seems to me, when advocates of the public option saw that they didn't have the votes for the public option, they kind of tried to get it down another path. And it made no sense. Hospitals, incidentally, I'm not the only person in the Democratic caucus who opposed the Medicare buy-in. You saw that 11 other Democratic senators wrote to Senator Reid telling him they were against it because of the impact they thought it would have on hospitals and doctors in their state, and by cost shifting on the 180 million people in America who get their insurance today through private companies. Their premiums would go up. So that's where we are now. This was unnecessary. The fact is that the more they try to sort of change it to get it through, separate insurance pools, separate from Medicare, self-sustaining, the premiums would have to pay for it, as I said to one of the advocates of it, nobody between 55 and 65 is going to be able to afford this plan. And he said to me, that's not the point. We're trying to work out a deal here. So I said, well, that doesn't make any sense to me, because in the long term, the danger will be that the federal government will be pressured to take this over, make up deficits in this separate pool. And again, it's not necessary. We've got a great health insurance reform bill here. And the danger was that some of my colleagues, I think, were just trying to load it up with too much. And what happens then is that you run the risk of losing everything. So I think what's beginning to emerge, though I know some people are not happy about it, is really a historic achievement. Healthcare reform such as we've not seen in this country for decades.
Are you surprised by the have you evolved at all in your process in terms of supporting and supporting this bill?
Well,
just speaking to the mic.
Sure. First, let me say that I'm grateful for the work that Senator Lieberman has done. I believe that his principal stance have improved the bill. I very much would like to see a health care bill that is based on lowering costs, expanding access, helping small businesses pass. But I don't see voting for the current bill that is on the floor, even with the improvements that have been made. I'm very leery of the impact of nearly $500 billion in Medicare cuts, particularly the cuts in home health care, which are completely counterproductive of the goal of lowering costs. Senator Lieberman and I, Senator Wyden and I have amendments to try to give more affordable choices and to lower the cost of health care. It remains to be seen whether those are going to be adopted. I'm concerned about the penalties that would be imposed on smaller employers. So this bill is getting better, but it's still too deeply flawed for me to support it.
But if this passes,
you had a conversation with the leadership about Senator Lieberman and Senator Wyden's proposal and your proposal to include that in the manager's amendment?
I have had some conversations, but they have not given me an answer at this point. I should make clear that while I care deeply about those amendments and believe that they make significant improvements in the bill, that their adoption would not be sufficient to persuade me to vote for the bill. I'm still very concerned about the enormous cuts in the Medicare programs and what that would mean to access to health care for our seniors.
Then why offer them if you don't think it's going to make...
Because I think something is going to pass, and I would like to make that bill as good as possible, even if ultimately it's not a bill that I can support. I believe that I have an obligation to try to improve the bill, not to just say no. And that's why I've been working with colleagues on both sides of the aisle on several amendments that I believe will improve the bill. And I'm going to continue to try to improve the bill.
Persuasion. Have you had any persuasion from the White, the other end of Pennsylvania Avenue in recent days?
I've had extensive discussions with the president, with his chief of staff, with the OMB director, with the White House health policy advisor. Those have been helpful, and I appreciate the dialogue that we're having, but they certainly have not moved me to be able to support the bill at this point. Thank you.
Thank you, Senator. Thank you.
There you have it, Senator Susan Collins, a Republican of Maine, but also the man of the hour, many would say, Senator Joseph Lieberman, talking about why he was opposed or is opposed to the Medicare buy-in after in 2000 saying that he was supported, and even a recent interview in September saying that he supported a concept of a Medicare buy-in. Senator Lieberman saying things have changed back in 2000. He was articulating the party platform, which looked at a Medicare buy-in as a way to perhaps offer health insurance or health coverage to many more Americans. He also took issue with the interview that he did in September with a Conneticut newspaper, saying basically that it was kind of out of context. He was referring or reflecting to 2000. So obviously much analysis will be given to the comments made by Senator Joseph Lieberman, but many have declared him a victor, as there are reports that the Medicare buy-in will not be a part of the health care legislation.